We will start our presentation about COVID-19 and mental health. So, during COVID-19 pandemic, social distancing lockdown are necessary to reduce the spread of COVID-19. So we will feel isolated and lonely, and it also can increase the stress and anxiety. So if we feel stress, stress can cause the following condition in our body, like feeling of fear, anger, sadness, worry, numbness, and frustration. Also change in appetite, energy, desire, and interest. Difficulty concentration and making decision. Difficulty sleeping or nightmares. Physical reaction like headache, body pain, stomach problem, and skin rash. And also can worsening the chronic health problem, worsening of mental health condition, increased use of tobacco, alcohol, and other substances. And it is nature to feel stress, anxiety, grief, and worry during the COVID-19 pandemic. But if we feel stress and enter fear and anxiety condition, when we facing a trick, the primitive amygdala will direct central and autonomic nervous system to trigger an all system alarm. So stress and fear are not only an emotional problem, actually it's the whole body organ and systemic problem in our body. So while we're facing the stress or infection, inflammation in our body, this is the same condition. Our brain will control the immune system through the HPA axis. This is hypothalamus pituitary adrenal axis. It can alter our immune system and release the cytokine IL-1, IL-6, and TNF. This condition is like we infected COVID-19. So neuroendocrine and immune system are closely interact with each other. Stress can cause physical and mental problems. So this is the social readjustment rating scale. And currently in COVID-19 pandemic, we can feel stress and during because of that of spouse or that of close family member, change in health of family member, or change in financial state, that of close friends, being or not being is the end of the school, and change in living condition, or revision of the personal habits, like change in sleeping habit or social activity. So these are the stressful event in our life. So our life is feeling of most of the stress and also fear. So in general population, clinically significant psychiatric symptoms of anxiety, depression, distress, and PTSD are up to 36% of the adults. Moderate to severe anxiety was present in 29%. And psychological distress like depression, hopelessness, and nervousness was found in 8 to 36%. And PTSD symptom is ranging from 3 to 7% of adults. In children, anxiety symptoms and depressive symptoms are each reported by about 20%. Almost two-thirds of the children are worried about being infected. In healthcare workers, I think most of us are healthcare workers. The prevalence of moderate to severe psychiatric symptoms are anxiety is 12 to 20%, depression is 15 to 25%, insomnia 8%, and traumatic distress is 35 to 49%. So the etiology of the psychiatric consequence is multifactorial. It includes direct effect of virus, include brain infection, cerebrovascular disease, including the context of procoagulant state, and degree of physiological compromised like hypoxia, the immunological response, and the medical intervention, social isolation, psychological impact of a novel, severe, and potentially fatal illness, and concern about infecting others and the stigma. So we will discuss how COVID-19 affects the brain. So we are talking about a mental illness, but the brain is related with both psychology and neurology. So the direct neuroinvasion of COVID-19 will induce headache, sleep disorder, olfactory and gustatory impairment, and most severe encephalopathy. COVID-19 infection trigger the immunity, causing massive inflammation of lung and brain. So the massive inflammation of the lung can cause respiratory failure and the mostly death of COVID-19 infected patient. And the brain inflammation can cause hemorrhage. And the hypercoagulation and aneurysm instability, partially due to systemic COVID-19 inflammation, might be the potential cause of the mental illness. So the SARS-CoV-2 enter into the brain capillary endothelial cell through ACE2 receptor. While the virus enters our vessels, it can cause neuroinflammation. And neuroinflammation can release cytokine and cause cytokine storm. And the endothelial damage can cause thrombus formation. Both the neuroinflammation and coagulation cases will lead to local microglia activation. The microglia activation can increase the glutamate and it will upregulation of the NMDA receptor and the depletion of the neurotransmitter like serotonin, dopamine, and norepinephrine. These other neurotransmission and neuronal damage can cause neuropsychiatric symptoms like attention deficit, cognitive deficit, new onset anxiety, suicidal behavior, depression, psychosis, and seizure. So the immune response in SARS-CoV-2 infection is related with hyperinflammatory state, and it can increase the concentration of CRP, ferritin, and IX6. And we also know the link between inflammation and depression is well described and might explain some of the psychiatric morbidity. So another topic is the behavior during COVID-19 pandemic. The individual performs specific behavior pattern to release stress and anxiety. They were more likely to browse internet and see health information, such as face masks and hand washing. But excessive internet browsing can also cause more anxiety. Healthy lifestyle and psychological intervention were recommended to boost the immune system against COVID-19. Furthermore, the government locked down the city. True lockdown seemed to be positive against COVID-19, but it had a deep impact on both the general population, social interaction, and the psychological well-being, like we will feel lonely and feel stressed, and the economic problem. So the connection between the psychoneuroimmunity model of brain behavior and immunity is like we talked about in the previous slides. So another symptom is long COVID symptom. It related with mental health and mental illness. The long COVID symptom is ongoing symptoms of fatigue, dyspnea, headache, cognitive impairments, cough, dry and chest pain, and mood alternation, smell and taste dysfunction, and myalgia that persists for at least 4 weeks after symptom onset or hospital discharge. So 30 to 80% of COVID-19 survivors have reported. It was lasting for 1 to 6 months, and it can happen to anyone, also in only mild COVID-19. So about 81% of COVID-19 cases are symptomatic and mild, but severe pneumonia and critical multi-organ failure happen to 40% and 5% of cases. COVID is may not fully recover and suffer a post-virus syndrome, and it includes our mental health condition. So the possible cause of long COVID is maybe related with long-term tissue damage or viral persistent chronic inflammation. And another topic is persistent brainstem dysfunction may also be involved. So there are two reasons we suggest that they were related with brainstem, because one, brainstem tropism and damage in COVID-19. The brainstem has a relatively high expression of ACE2 receptor compared with other brain regions. Evidence also exists that neuropilin-1, a co-receptor of SARS-CoV-2, may be expressed in the brainstem. So in the picture, we can see the derived viral infection in our brainstem can cause neuroinflammation, microglia activation, astrocyte activation, and leukocyte infiltration can cause inflammatory mediator and vascular activation. The second is the function of the brainstem that overlap with symptoms of long COVID. The brainstem contains numerous distinct nuclei and subparts that regulate the respiratory, cardiovascular, gastrointestinal, and neurological process, which can be linked to long COVID. So in long COVID can cause cognitive problem, insomnia, anxiety, depression, headache, fatigue, and myalgia. So among the patients with COVID-19, the prevalence of depression is about 38%, and the anxiety is 38% and insomnia is 48% respectively. And poor sleep quality among COVID-19 patients were also associated with a slow recovery and increased need for intensive care. And in severe coronavirus infection, this is a systemic review. In acute phase, insomnia is about 41%, anxiety and depression is about 35 and 36%. The post-illness will decrease, but it will still persist. So we want to know what are the protective factors of the mental health. So the greatest protector was spiritual well-being. And the stronger protector of mental illness, physical health, mental health is the loneliness. The potential protector of healthcare staff is job satisfaction. So another factor is environment problem. In Croatia, the earthquake occurring with COVID-19. More people show mental illness than infection. Mental illness might impede recovery process. Like our country, the political issue and the COVID-19 issue, I think maybe the same condition. Psychosocial factors that related with psychiatric illness are frequency and external exposure to individuals infected with the virus, and the fear of infecting family members, and lack of access to testing and medical care of COVID-19. Physical distancing, home confinement, quarantine, and loneliness. The inconsistent message and diversity regarding public health measures such as wearing face masks or not. And increased warlocks, economic hardship and insecurity, shortage of available resources like food, paper products, and personal protective equipment, and diminished personal freedom, continuous media reporting about the pandemic and the uncertainty surrounding its eventual outcome. So during the pandemic, use of alcohol and tobacco are increased. In regular drinkers, 22% increased the amount of alcohol consumed. In ex-drinker, recurrence of alcohol use disorder occurred in 19%. In regular smoker, 20% increased the amount of smoker, recurrence of tobacco use disorder occurred 25%. The COVID-19 pandemic may also increase the risk of suicidal ideation and behavior. It may be related to adverse effect of quarantine, the hardships imposed by the pandemic, the economic privation, social isolation, reduced access to general medical and mental health care, and the stigma of having COVID-19. In patients with pre-existing psychiatric illness may exacerbate the pre-existing illness. 20 to 20% of patients with various disorders think they are coping poorly and deteriorating. New or worsening mental health problems are anxiety, depression, and insomnia. It may be attributed to fear of infection, restriction on transportation, and isolation at home. So in schizophrenia, worsening of mental illness and social circumstances like homelessness, they will have poor health outcome because 95% of schizophrenia patients with nicotine dependence. So the smoking can cause chronic illness. When these patients are infected by COVID-19, their outcome is poor. And the impaired ability to follow public infection control measure is like physical distancing, hand washing, and wearing masks. So in schizophrenia patient with poor adherence, we can use long-acting injectable antipsychotic drug. And psychiatric inpatients are increased risk of COVID-19 because close quarters, often free to move about one space on units and interact with other patients. Frequently in contact with nursing staff, may be required to use shared bathroom. Because of psychotic symptoms, cognitive deficit, disorganized thinking, behavior dysregulation, and poor insight, the patient may have difficulty following infection control measures such as physical distancing and hand washing. So how can we manage about the mental health problem during pandemic, COVID-19 pandemic? First, we must surveillance for the domestic violence and child abuse because both which are predicted to increase during the mandated stay-home orders. And online clinician guide self-help or pure self-help cognitive behavior therapy may also be beneficial. In my psychiatric symptoms related to COVID-19 pandemic, we can limit one's intake of print and broadcast news about the pandemic. Maintaining routines for sleep, walk, and getting dressed. Maintaining structured activities such as exercise, engaging in pleasurable and relaxing activity. Staying connected to family and friends via phone and computer. So this is the WHO suggestion coping with stress during the COVID-19 outbreaks. It is normal to feel sad, stressed, confused, scared, or angry during a crisis. Talking to people you trust and can help. Contact your friends and family. If you must stay at home, maintain a healthy lifestyle, including proper diet, sleep, exercise, and social contact with loved ones at home, and by email, phone with other family and friends. Don't use smoking, alcohol, or other drugs to deal with your emotion. If you feel overwhelming, talk to a health worker or consultant. Have a plan where to go and how to seek help for physical and mental health needs if required. Get information that will help you accurately determine your risks so that you can take reasonable precaution. Find a credible source you can trust, such as the WHO website or a local state public health agency. And limit worry and agitation by lessening the time you and your family spend watching or listening to media that were pervasive as upsetting. And you can draw on skill you have to use in the past that have helped you to manage previous life adversity and use the same skill to help you manage your emotion during this crisis. For moderate to severe psychiatric symptoms related to COVID-19 pandemic, treated by their primary care provider or referred to a mental health specialist. The psychiatric care should be administered by computer or telephone rather than face-to-face. Patient contact through voice or voice plus video may be superior to text message and email. Multiple studies suggest that our patient and their psychiatric are generally satisfied with the transition to telemedicine with video visit and or phone visits. In pharmacotherapy, we must familiar with the medication that are currently being used in our patient. Any other prescribed medication, like supplements that may be taken in their belief that might reduce vulnerability to COVID-19 infection. And dexamethasone is associated with psychiatric side effects, such as depression, emotional lability, euphoria, insomnia, malaise, personality change, and psychosis. But steroid-induced mania and psychosis is only 0.7% in patients with SARS in the acute stage in one study. And psychotropic drugs can be safely. They do not seem to interact with antiviral agents like antidepressant escitalopram, antipsychotic olanzapine, benzodiazepine, lorazepam, and mood stabilizer valproate. And we should be aware of the potential drug-drug interactions. So family members of a loved one who is severely ill and dying will respond with grief. So if our patient faces grief, we must love them, expressing sorrow for the loss, acknowledging their pain, answering questions about their loved one's final days. Ask the family about thoughts, feelings, and behaviors related to their loss, and can provide grief counseling. This is the 5 stage of grief. So in our patient and their family who lost their loved one, they can feel initially deny, then anger, bargaining, and depression, then finally acceptance. So we can see all those emotions in our patient and their family when they are facing the COVID-19 crisis. Coping behavior and strategy. Healthcare workers use a variety of approaches of coping with stress related to COVID-19 pandemic. That coping behaviors include physical activity, exercise, psychotherapy, yoga, religious or spiritual practice, meditation, virtual support groups. So a study of clinicians in public hospital emergency department in Hong Kong during 2003 SARS epidemic. The most frequent coping strategy include accepting the reality of the stressor, taking action to circumvent the stressors, viewing the situation in a more positive light, and attempting to grow from the situation. And a follow-up study of hospital employees who were exposed to 2003 SARS epidemic in Beijing. Higher level of altruistic acceptance of risk during the outbreak, like I want to help the patient and accept the risk. This thinking were associated with lower level of self-reported depressive symptoms 3 years later. So this is the WHO suggests having children cope with stress during COVID-19 outbreaks. Children may respond to stress in different ways, different from adults, such as being more crying, anxious, withdrawing, angry, or agitated, bedwetting. Respond to your child's reaction in a supportive way. Listen to their concern and giving them extra love and attention. Children need adults' love and attention during difficult times. Give them extra time and attention. Remember to listen to our children. Speak kindly and reassure them. If possible, make an opportunity for the child to play and relax. Try and keep children close to their parents and family and avoid separating children and their caregivers to the extent possible. If separation occurs, like hospitalization, ensure regular contact with phone and reassurance. Keep the regular routine and schedule as much as possible, or help create a new one in a new environment, including school, learning, as well as time for safety, playing, and relaxing. Provide feedback what has happened, explain what is going on now, and give them clear information about how to reduce their risk to being infected by the disease in words that they can understand depending on their age. This is also include providing information about what could happen in a reassuring way, like a family member or the child may start not feeling well and may have to go to hospital for some time, so doctor can help them be better. And so this is my presentation.